So as the populations expanded, were there any changes in the safety signals that you were seeing?
No, no, and that's what's kind of remarkable about this drug. We've now this trial has been going on, especially the phase 1, for example. I still have patients on that trial.
As do I.
Yeah, seriously. So, and the safety the safety signal really has not changed. Occasionally, and this is not in all patients, patients who do stay on the study longer do sometimes get a myalgia, muscle pain, when they do not take their drug on time. But overall, these adverse events are very mild. The dizziness is probably one of the more common adverse events, seems to improve over time. And so, and none of the liver toxicities seem to have gotten worse or been concerning as the trials and the patients who've been on trials have continued.
So then you bring up a good point, because people are on these drugs for a really long time, which for many kinase inhibitors can be challenging. Can you tell us a little bit about the patient-reported outcomes that were presented?
Dr. Kumar, our colleague at Stanford, presented the patient-reported outcomes, which they used, I think, the EORTC-QLC criteria, and showed significant increase in these patients' quality of life, essentially, starting before they started the trial and after. Almost 70% of these patients had significant quality of life improvement. And so...
And how long did it take for them to start experiencing that, did they say?
Offhand, I don't know the answer to that, but I think, at least in my experience, most of these patients will tell you within days to within weeks.
Yeah, I think that their data said as soon as after the second cycle.
Yeah.
It's amazing,
Yeah.
okay. So what about the safety and efficacy profile of Laro, which is obviously very good? Can you just talk a little bit about how it compares to other types of options? And that's hard because we've obviously many tumor types. But
Correct. I think overall, I think in this refractory population, if you're talking about other options, particularly, for example, like sarcoma, there were many of these patients who've gone to the trial. There were not options, and the options were standard chemotherapy. I think overall the safety profile, the durability of response, and I say this, and I don't say this as kind of advertisement, I think, but it's just my own experience. If you ever treat a patient with NTRK fusion with Larotrectinib, you don't forget it, because these responses are incredible, and for many of these patients, the therapy is life-changing.
As I mentioned, the response rates are quite high. The durability seems quite good. Toxicity is fairly tolerable. We do see some constipation and edema, some fluid retention, some episodes of paresthesias and mild neuropathy, although for the most part these side effects are grade 1 or grade 2. No showstoppers in terms of systemic toxicities, and that's critically important for any agent that's going to be given orally and continuously. With chemotherapy, we often contend with acute nausea, vomiting, transient neutropenia, but patients recover from that. You can't tolerate those sorts of toxicities on a long-standing basis with oral agents that are given on daily. The updates have shown that many of these partial responses have now deepened into complete remissions. The CR rate appears to be about 10 to 12%. We're starting to see higher numbers of lung cancer patients. In the original series, it was 3 responses out of 4. Now I think they're up to about 10 or 12 patients, but still a very small percentage overall who have NTRK abnormalities with lung cancer, and actually a relatively small percentage on the trial that had lung cancer. No major surprises, essentially just a deepening and broadening of the original data that were cited in the landmark New England Journal paper.